Hey guys, how are you and welcome to my YouTube channel. I am really glad and excited to have you on board. My name is Dr. Viknell. I'm a practicing medical officer in Kenya. Welcome. Today we are talking about things that could easily put you at risk of getting a miscarriage. Tune in and let's do this. Now, guys, according to the World Health Organization, a miscarriage is whereby you have expulsion, or rather extraction, of the fetus when it's still weighing less than 500 grams or when it's still before 22 weeks of gestation. As a modern woman, you don't need to worry about how many weeks am I. There's an app, a pregnancy calculator, which you can use. I use this at my place of work, and all you need to do is to input the first date of your last menstrual period, and then it will bring you the estimated date of delivery, when you're likely to deliver, and the gestation in terms of weeks. Now, a miscarriage could occur either in the first trimester or in the second trimester. A trimester is 3 months. Pregnancy, 9 months. In weeks, those are 40 weeks. So the first 3 months, first trimester, or the first 12 weeks. Now guys, in the first trimester, some of the things that could easily put you at risk of a miscarriage. Before I go to that, how will you know you have a miscarriage? Common symptoms in a miscarriage are: number one, bleeding coming off from your vagina. There are different types of miscarriages. I'll be dealing with that in the videos that follow. But basically bleeding, it could be a lot of bleeding or moderate bleeding. And then many times after you started bleeding, there's an associated cramping or pain around your lower abdomen, or some people tend to experience this pelvic pressure. There's this pressure being forced down your lower abdomen, or rather your pelvis. Now, some of the things that could put you at risk or that could cause a miscarriage in the first 12 weeks or in the first trimester, number one, in many cases, are genetic issues, what we refer to as chromosomal abnormalities. For those of us that have made it to high school, we have been taught about the chromosome. This is basically that thing which carries genetic material that makes you to be who you are today. So in some people, there's an issue with this genetic makeup, or rather these chromosomes in simple terms, and you have issues that result, and then whatever is the outcome of that issue is not able to sustain a life till term, or sometimes you give birth to a child who has many other issues, and that's because of chromosomal abnormalities. So that is the main thing. Unfortunately, I'm not sure of how this can be prevented, but I know with continuous research, a way will be found. The second thing that could put you at risk are what we refer to as endocrine abnormalities. When I talk about endocrine, I just refer to the hormonal issues. For your pregnancy to survive well, mostly in the first trimester, there's a hormone which is produced to help maintain the endometrium. The endometrium, where after the ovum and the sperm fertilization has taken place and an embryo is resulted, it comes and implants in the endometrium of your uterus. So for this endometrium to be stable and well to be able to hold that implantation, to hold that pregnancy, there's a hormone which is referred to as progesterone that is produced. So you at times have issues, and this hormone either is not produced sufficiently, and so your endometrium is not that stable, what you refer to as the luteal phase deficiency. So I'll not go into details, but just know at times a hormone that's supposed to maintain your endometrium of your uterus, where your baby will continue growing, is not sufficient enough, and that could put you at risk. We also have other hormonal issues. There are people who have issues with the thyroid, either excessively low thyroid hormones or excessively very high thyroid hormones. Such could put you at risk of a miscarriage in your first trimester. And then we've also had an association of diabetes, especially when it is not well controlled, and could easily put you at risk of getting a miscarriage. And then we have other things that could put you at risk of getting a miscarriage between the 12th week and in your second trimester, before 22 weeks. And these majorly, number one, there are times, there's something we refer to as cervical incompetence. So at this point, you have your uterus, at this point you have your cervix. Now with cervical incompetence, the cervix is not stable enough to hold the pregnancy and easily gives way, allowing the pregnancy to come out. Now the good thing is, in cases of cervical incompetence, with pregnancies that follow, something referred to as a mark stitch or cervical sacrilege can be done to try and keep your cervix in check. The other thing is that we have women who have, as a normal person, standard, you have a uterus that is one womb. But then we have people whose uterus is divided into two. So this is the uterus, but then there's like a septum, it's divided into two. So you find that your child is growing from just one side, and the volume inside that one side might not be enough to sustain the continuous growth of the baby. So easily puts one at risk of getting miscarriage. And this can easily be known when you do an ultrasound. So if you have the biconate uterus or one that's divided into two, that can easily be known, and the necessary measures will be taken. And then guys, as we go on, we have those people who have uterine fibroids. So a fibroid could be placed, could be positioned, mostly what we refer to as the submucosal. They are positioned almost at the inner lining of your uterus or endometrium, where implantation has to take place. And fibroids at times cause a lot of irritability. They could also reduce the intrauterine volume that is needed, and that could put one at risk of miscarriage and even recurrent miscarriages at some point in time. We have autoimmune diseases affecting women that could put them at risk of getting a miscarriage, mostly in the first trimester. In some autoimmune diseases, what happens is that your body is producing what we refer to as antibodies. These are the protective factors, the guns that keep you safe, that fight evil things in your body. So these antibodies could go on destroying a woman's own tissues, destroying the placenta, and as such, pregnancy cannot be maintained. Then we have infections, which could put you at risk of getting a miscarriage either early or late. It could be a viral infection such as HIV, rubella. It could be a bacterial infection such as brucella. And most commonly in our African setup, Kenya to be specific, we have malaria that puts women at risk of actually getting miscarriages. And then we have other issues or other factors such that, like, there are people, we have what we refer to as the amniotic fluid that keeps your baby in sync in the womb. So there are people who unfortunately have what we refer to as preterm premature rupture of membranes, and you find that this liquor comes out before time. Many times when this fluid starts coming out, such people tend to lose their pregnancy. And then finally, guys, about 40% of causes of miscarriages cannot be explained. But at least we know about 60%, and we can do something with about 40% of that which we know. So that's it for me. That's it for me. Anytime you see bleeding with pain at any point in your pregnancy, please, I repeat, go and see your healthcare provider. Karibu sana to my YouTube channel, and next I'll be talking about subscribe to know what's in store for you. Thank you.